Welcome to the OncoAlert video recap of the ASCO Plenary series from the 25th of January, 2022, covering the INTRIGUE trial and presented by Dr. Michael Hendrick of the Portland VA Healthcare System and Oregon Health and Science University. The INTRIGUE trial is a randomized phase 3 trial comparing Ripretinib to Sunitinib in patients with advanced gastrointestinal stromal tumors following first-line imatinib. INTRIGUE was designed to see if Ripretinib might offer a superior alternative to Sunitinib in those with advanced GIST which progressed or were imatinib intolerant. In the trial, 453 patients with GIST participated, 73% harbored disease with a primary KIT exon 11 mutation. Primary endpoint was progression-free survival. Secondary endpoints were objective response rate and overall survival. The results were that the INTRIGUE trial failed to meet its primary endpoint of progression-free survival. 80% of GIST have primary oncogenic mutations in the KIT gene, mostly in exon 11. INTRIGUE saw median progression-free survival was longer with Ripretinib versus Sunitinib in patients with GIST and KIT exon 11 mutations, 8.3 months versus 7 months, however, did not meet statistical significance. When it comes to objective response rates, these similar trends were seen, showing that Ripretinib had an advantage in the subgroup in the KIT exon 11 mutations, but less of an advantage in all of the patients treated. In both Ripretinib and Sunitinib, efficacy seemed to be comparable. However, Ripretinib was more tolerable than Sunitinib, which is known to be more toxic. Grade 3/4 treatment emergent adverse events were in fact a lot lower in Ripretinib, comparing 41.3% to 65.6% with Sunitinib. And although the INTRIGUE trial was in fact statistically negative, what we can learn from this is that even efficient drugs can fail a trial when trying to show superiority, and doctors need to use the data presented to build the best treatment plan for an individual, taking consideration their situation and preference. There is no doubt that Ripretinib benefits people with GIST. Even if no plans have seeking regulatory approval of a second-line therapy, Ripretinib is still an available fourth-line option for those with GIST. Thanking our collaborators at the American Society of Clinical Oncology and you, our colleague, for your continuous support of the OncoAlert Network.